Lori Jones with SERHANT. I'm here at Arizona Heart Foundation with my friend Paula, and I'm so excited to bring you the Arizona Heart Foundation and what they do for your state. So Paula, we met, I believe, 4.5 years ago.
Yep, almost 5 years.
Yeah.
Yep.
And I was researching heart foundations because of my story. Mm-hmm. And for those who don't know my story, my son had heart surgery at 29 days old. He had a very rare condition, and he had 5 holes in his heart and coded twice during surgery and almost didn't make it. My mom had a double bypass, and my father died of heart failure. And if you go on down the line, Grandpa died of heart failure. So heart disease and how we prevent it means the world to me. Mm-hmm. And when I met you, we instantly connected, and we just have been friends ever since. Mm-hmm. Mm-hmm. But I want to share what the Arizona Heart Foundation does for Arizona.
Thank you, Lori. What you have just described is really what we call a predisposition for cardiovascular disease. And here at the foundation, we have been in existence for over 50 years. And we have always prided ourselves in research and education. And that remains the same today. We have an ultrasound school. We specialize in cardiac, vascular, and general ultrasound. And what we've done with that is not only educate the next generation of sonographers, but we've also started a cardiovascular initiative where our mission and our passion is to go out and have everyone have a complimentary cardiac ultrasound or even a carotid ultrasound. And the reason that we want to do this is because everyone should have this done. We are not a pediatric foundation, so we do not do young adults under, I think it's 15 years old. But if you're over 15 years old, you should be in here getting a baseline ultrasound. The ultrasound does not really look into your arteries, but it can tell the function of your heart. It can tell the wall motion. It can tell us if there's a part of your heart that may not be getting a lot of blood flow. So everyone should have this done.
And I know, in the past years, I've had a lot of friends get their heart scanned. We had a couple friends bet on it. They were both ex-athletes.
Yes.
And they made a big bet. We won't say what it was. They wanted to know whose heart was the healthiest because they both felt, being ex-athletes, one was going to beat the other. Mm-hmm. But we also, have done a lot of good with people that are kind of scared to get their heart looked at. And
exactly.
A lot of, physicals, and they're not checking the heart.
No.
And I've had, 2 friends die, in the age of 40, drop dead exercising, and one passed away in court. Like it's just
scary.
A crazy thing.
It is scary. And that's why everyone should have this.
Yeah. And both of them were females. So I think a lot of females don't understand that that's like one of the number one causes of death is heart.
Mm-hmm. So if you were to ask any person on the street, what is the leading cause of death for women, they would probably say breast cancer.
Yes.
And if you add up all the cancers that women can have, it still doesn't come close to heart disease in women. So you're also describing risk factors.
Yeah.
And, we can modify our diet. We can modify our exercise. We can quit smoking. But you can't change who your family is. You can't change your genetic makeup. And that's why there's a lot of people that think they're in great shape, and they will have a heart attack exercising.
Yeah.
So we really want to work with businesses and individuals and companies that just want to have their population screened.
Yes. And it is read by physicians.
It is read by physicians. We have our imaging center, which is across the hall from our educational center, and we offer physicians to see their patients in our imaging center. Physicians that may see patients outside of Maricopa County, but also have patients within Maricopa County that we would like to see them. Maybe they want to come for 1 day a month. Maybe they want to come twice a month, once every 2 months. It's a space that is beautiful. It has 5 exam rooms, and they can come and see their patients where they're closer to their home. And so we offer all ultrasound exams at the clinic as well.
Well, I can't thank you enough. I've absolutely enjoyed everything, and I'm so glad that we're friends. And what you do for the public is absolutely amazing. And you guys are just very blessed, and we're very blessed to have you.
Thank you.
Hi, everyone. It's Lori Jones, and I'm here at Arizona Heart Foundation with my friend Eileen. And I'm so excited to share everything that the Arizona Heart Foundation does, the school. But I want to know from you, because you've taught me a lot about the heart. Tell me what the difference is, heart attack, cardiac arrest. Like, people say, well, their heart stopped and they dropped, or people say heart attack. Like, help me understand that.
Sure. And thanks for having me. It is usually very challenging for people to understand the difference. And I always use the analogy of a home. You have electricity and you have plumbing.
Perfect for me.
And it works the same way with the heart. So a plumbing issue would be that they could have coronary artery disease or some type of blockage within the artery. And that would be a heart attack if that blockage happens. Not necessarily die immediately, but definitely have all of those symptoms. If we talk about the electrical side of the heart or the electrical in our houses, that's going to cause an abrupt stop, which is going to be sudden death. The first symptom or first sign of cardiac arrest is sudden death. So you only have seconds to immediately get a defibrillator in order to try and revive that patient, where a heart attack, it doesn't happen that way. It could, but doesn't usually happen that way. So yeah, it's very important to know the difference between the two, and your reaction time needs to be very rapid with cardiac arrest.
And then when people come here and get their heart scanned, when they read the results, how can they try to stop or prevent one or the other? Is there a way, like when you get all the report, how can they, make changes for the better?
Well, the challenging part about receiving an echocardiogram is it's at rest.
Okay.
And a lot of times, people that suffer some type of cardiac episode is probably going to be during exertion. So, but the good part is we can see portions of the heart muscle that may not be receiving adequate blood flow that could indicate that they have a blockage or a coronary artery disease. So all of our participants receive a preliminary report that they can share with their primary care provider. If we notice something or it brings alarm on a valve or the way the heart is functioning, then we send those images to our physician, who finalizes that report, and it's officially considered diagnostic. And we let them know by recommendation what the next steps should be in seeing their own primary care, to find out if further testing needs to happen for that patient, or we send them to the emergency room, which we have.
You guys are seriously saving one heartbeat at a time.
We are, for sure.
Oh, thank you for everything you do. I appreciate it.
Thank you.